Okay, so like all the other chapters in this book, we talk a little bit about the anatomy and function, and then we talk about disorders, because largely in PT we are treating disorders. So we are going to, the main thing I want you to get out of this disorders section is the 4 Ds of brainstem dysfunction. Okay, so we'll talk about it. So when a neurologist or a physical therapist is evaluating the functions of cranial nerves and vertical tracts in the brainstem region, it can allow them to localize lesions within the brainstem. Okay, that is not something that we do because we don't evaluate, but it's nice to know that is how lesions are localized within the brainstem. A single brainstem lesion can cause a mix of ipsilateral and contralateral signs. Because cranial nerves supply the ipsilateral face and neck, and a lot of the vertical tracts cross the midline in the brainstem to supply the contralateral body. So if you have a disorder in the brainstem, you can get ipsilateral symptoms in the face and contralateral symptoms in the body. Lesions in the brainstem can also interfere with vital functions and consciousness, because remember, we talked about the reticular formation, which controls consciousness and alertness. The medulla and the pons control a lot of those vital functions. And so if you have a disorder in the brainstem, you can have issues with vital functions. That's not a good thing, because obviously if you have issues with vital functions, it can kill you. Vertical tract signs. So the lateral corticospinal tract, the dorsal column medial lemniscus, and the spinothalamic tract connect the spinal cord with the contralateral cerebrum. Remember, we talked about that in the vertical systems. So lesions of the lateral corticospinal and dorsal column tracts in the brainstem usually cause contralateral signs because those tracts cross the midline in the inferior medulla. So if you have a lesion in the midbrain, the information coming from the contralateral side of the body has already crossed over at that point, because it crosses over at the very bottom in the inferior medulla. So that's one of the ways they localize a lesion. The cortico-brainstem tract lesions, so there are motor signals that are conveyed from the cerebral cortex to cranial nerve nuclei in the brainstem. Neurons with axons in the cortico-brainstem tract serve as motor tract neurons to several of the cranial nerves listed there. So motor tract lesions are often associated with muscle hypertonia. So we talked about them in the motor chapter, in the 2 motor chapters, as upper motor neuron lesions. So those upper motor neuron lesions often have hypertonia, extra tone. Motor neuron lesions that are associated with hyporeflexia and muscle flaccidity, those are the lower motor neurons. So if it's upper motor neurons, hypertonia, lower motor neurons, hyporeflexia, and muscle flaccidity. So when we talk about the symptoms of brainstem dysfunction, some of them are hypotone and hyporeflexia, and some of them are hyper. So a single lesion in the upper anterior medial medulla on the left side, that makes sense, can cause paralysis of the right hand and foot, because our lesion's in the medulla on the left. It's the contralateral side of the body. It can cause loss of light, touch, and proprioceptive information on the right side of the body. That's our dorsal column. So the paralysis of the right hand and foot is the lateral corticospinal tract. The light, touch, and proprioceptive information is the dorsal column, medial lemniscus. And paresis on the left side of the tongue, that's the cranial nerve portion of it. So you have that mix of contralateral and ipsilateral signs in the head and the body. And you will see that with cerebrum injuries as well, like CVAs and brain injuries. And we'll talk about those in a later chapter. So disorders of the vital function secondary to brainstem damage can cause the heart to stop beating. your blood pressure to fluctuate, and that's really not a good thing, and breathing to cease. There are areas in the medulla and the pons that regulate vital functions. So a brainstem injury can kill you. So it's very serious because so many important functions are being controlled in the brainstem. The 4 Ds of brainstem region dysfunction, these are cardinal signs of brainstem dysfunction. If you have these signs together, that could indicate a brainstem issue. So dysphagia, which is difficulty in swallowing, that makes sense, right? Because a lot of the motor nerves involved in swallowing are the cranial nerves, and they come out from the brainstem. Dysarthria is difficulty in speaking. This tends to be an upper motor neuron issue. So those motor tracts that control the muscles of speech make it difficult to speak. This is different from aphasia, which is a cerebrum issue, and we will talk a lot more about that. Dysarthria is more of a harsh, jagged speech. So if you think about it as hypertonia in the muscles of speech, that's what causes the difficulty in speaking. Diplopia is double vision. So we will talk in the next chapter about vision and how the eyes work together, and the all those cranial nerves that involve the control of eye muscles and vision. You can see how if cranial nerves are affected, it could cause double vision. Dysmetria is the inability to control the distance of movements. So that is sort of that communication between the pons and the cerebellum, all that processing that has to go on. You reach out for your coffee cup and you miss. You don't get the coffee cup, or you don't reach far enough. So dysphagia, dysarthria, diplopia, and dysmetria, those are the 4 Ds of brainstem dysfunction. Do you think those are going to show up on the exam? I think they are. You can also have, with brainstem disorders, you can have disorders of consciousness because of that reticular formation. So states of altered consciousness can occur with lesions to either the brainstem or the cerebrum. So brainstem damage affecting the reticular formation or axons of the ascending reticular formation interfere with consciousness. Damage to the cerebrum that interferes with hypothalamic or thalamic activating areas or with the function of the entire cerebral cortex may also impair consciousness. So a disorder of consciousness could indicate a brainstem lesion, or it could indicate a cerebral lesion. Tumors in the brainstem region or in the cerebellum can cause increased cranial pressure because they're in that tiny posterior fossa. There's not a lot of room in there. So the increased pressure can cause headache, nausea, vomiting, cranial nerve disorders, or hydrocephalus, which is buildup of fluid in the brain. And we'll talk more about that in the next module. If the tumor is within the cerebellum, you frequently get ataxia, which is that incoordination of movement. Damage caused by a benign tumor may be extensive because it's pressed in there in unyielding bone and the dura mater to prevent brain tissue from moving away from the pressure. So even a benign tumor can cause huge damage in the brainstem region because there's just not a lot of room in there. It's like driving in Seattle. There's a lot of traffic and there's no place for it to go because you're all hemmed in by mountains and water. I don't know if that's a good analogy or not. So ischemia in the brainstem can produce abrupt onset of neurological symptoms, including dizziness, visual disorders, weakness, incoordination, and somatosensory disorders. That all makes sense, doesn't it, with what we talked about with cranial nerves and the vertical tract functions. So ischemia in the brainstem region can have widespread effects throughout the body. The vertebrovascular artery provides blood to a lot of the brainstem region. And so if you have insufficiency in that artery, it can produce transient symptoms of brainstem region ischemia when the neck is extended and rotated. So dizziness, visual disorders, etc. So just like any of the other arteries, if you have insufficiency, like if you have insufficiency in the coronary arteries, it causes angina. If you have insufficiency in the arteries taking blood to the brain, it can cause transient ischemic attacks. If you have insufficiency in the vertebrovascular artery, it can cause these transient brainstem region symptoms. So a lot of times the collection of symptoms is what allows doctors to figure out where the problem is.